Today I had open heart surgery. I had a heart valve replacement and a double bypass. That finished up around 12 noon. It lasted for about 5 hours. Um, when I came to, obviously I was pretty groggy and drugged up, and I was on a trach. And I got to say that's a pretty interesting experience. I stayed on the trach for about 3 hours, and when they pulled it out, it was, kind of interesting. It kind of reminded me of the movie Alien. Uh, Very weird, but it's out. It really wasn't that painful, and I'm talking up a storm now. Um, just to talk a little bit more, I how do I feel right now? As you can tell, I'm kind of mumbling a little bit. Well, I feel comfortably numb, meaning I am high as a kite. I don't know what type of drugs I'm on, but I'm pretty high. I am loopy, so if I kind of stumble around or lose a few words or say something not appropriate, like alien, for example, please excuse me. Um, just to show you what's going on with me, you can see I'm really well connected here, and I'm not talking about social media. I'm not talking about the internet. Although this video will be uploaded to YouTube. My nurse here is Lorraine, and she's going to talk a little bit about what I'm connected to and what each of those connections performs or does. Hi, Lorraine.
Hi. Robert did wonderfully. He got extubated in 4 hours, which is very uncommon. We try to do within 6 hours. He's on minimal support for his blood pressure, and due to the fact that while Robert is fairly healthy, has no major medical issues, he's not required much in regards to medications, but he did come back with an endotracheal tube which came out, and he has a Swan-Ganz catheter through an IV that's in his neck that we administer medications through and monitor his heart in regards to whether or not he needs fluids or he needs diuretics. In addition, he has one chest tube to monitor whether or not there's extra fluid coming out of the chest wall, which will probably come out tomorrow. And he has epicardial wires connected for support, just in case he needs backup for his heart to having an irregular rate.
Where are the?
Those are in the sternal area. There's 2 wires in the ventricle and 2 wires in the atrium, and they come externally out, and then we hooked him up to an external pacemaker if need be. He also has a catheter in his bladder. We monitor his urine output well. He had a graft taken from his left leg and his internal mammary vessel, and so due to that fact, at this hospital we put a ACE wrap around to decrease the pressure and decrease any swelling from when the vein comes out, and that comes off in a couple days. He also has a drain coming out because he had a little bit of blood drainage, a little bit more so than normal, so we put this drain in so that his leg wouldn't swell up. But Robert's doing very, very well. I see him out of bed tomorrow, walking in the hallways, and home within 5 days or less.
All right, that's good news. Thank you, Lorraine. In terms of pain management, pain level, right now I'm not on any morphine, and I seem to be managing okay. I do, obviously, it does hurt. And how do you describe it? Well, I feel like my heart's been taken out of my chest. So, it's there and it's noticeable. In terms of my leg, I really haven't felt anything in terms of pain in my leg. Nowadays, when they harvest veins from the leg, unlike when my father had his five-way bypass, yes, it runs in the family. Back in the early 90s, they would literally fillet the leg and get the vein out. Now they go in through orthoscopic surgery, small incisions, and that's how they harvest the leg. And I'm grateful about that. So anyway, I'm gonna sign off for right now. Tonight I may take some pain medication to help me sleep, and I will see you later. Good night, and stay tuned.